If you are a male who is experiencing chronic fatigue, feeling tired all the time, you're having a brain fog, you feel like you're leaky, you're always having those aches and pain all over your body. If you start to have low sex drive, irritable sleep, and anxiety for no reason, if you feel like your skin is getting so dry, you're constipated most of the time, your digestion is not the same, these all can be signs that you might start to have some hormonal imbalance. And believe it or not, men also go through hormone imbalance, not just female. So the main hormone for men, of course, is the testosterone, and testosterone is responsible for a lot of vital functions in your body. And when the testosterone starts to go low, not necessarily it has to disappear from your blood completely, but once it starts to go lower than the level that you used to, you definitely start to feel all of these symptoms getting into you. If you feel like you're experiencing any of that and you would like some medical advice based on your symptoms, I will definitely be more than happy to help you with that. My name is Dr. Marina Beshay, and I'm a certified family physician in Ontario, Canada. And I've been living and working as a physician in Canada for over a decade now. And I've been helping a lot of my male as well as female clients with hormone replacement therapy, which is known as HRT. I always do the bioidentical one, which is known as BHRT. The process, if you think that you might benefit from the BHRT, is you start by booking a consultation with me, and before the consultation, we will do a full blood work. This full blood work will include everything to be checked, like a complete hormonal panel for you that will include your testosterone, your thyroid, your vitamin D, so many other vitamins in your body. It will also include your sugar, your cholesterol, your kidney, your iron, everything that you will think of will be checked on this blood work. And we will need to spend at least half an hour going through your blood work in very much details. When you go through the blood work, you will be able to know exactly what supplements you are missing on. So we will come up with a list of supplements that you will need to start immediately after. And we will also look into your hormones and we'll see if you really need to go on hormone therapy. And if you do need to go on hormone therapy, we will discuss the options at that point. The options can be like a testosterone cream if you need it. It can also be a pellet. And if you haven't heard about the pellets before, pellets are tiny capsules that comes in a very small vial. It's being compounded in one of the pharmacies in downtown Toronto. They deliver it to us and we use it directly. So the procedure is very simple. It's only a 10 minutes procedure, many invasive. It starts with a very small, tiny cut in your skin and goes all here in your glutes. And you will be completely numb, so you don't really feel it. And the pellets will be inserted into your body. When the pellets are inserted into your body, it will slowly release the hormone and that will stay in your system for a minimum of 5 months after the procedure. So usually these pellets will last anywhere between 5 to 6 months. Everybody is different and the metabolic rate is different. This is why we have this kind of range of time. After 5 to 6 months, when the pellets are over, we will definitely need to repeat the procedure again and insert two more pellets. After your original blood work, once we start as a treatment, regardless of which option you decide that you will go with, we will need to do a follow-up blood work that will be anywhere between 6 to 8 weeks based on the treatment we will start and also based on your blood work numbers. When I see you for the follow-up blood work, we will see where your numbers are, compare them to your original numbers, and of course, I will also see how you're doing at that time. And based on how you're doing, we can definitely see if any changes has to happen or if everything is good, then you will be good for at least another 6 months before you need to come back for another procedure or a follow-up. I also have to touch point on the fact that there is a big difference between having normal level of testosterone versus optimizing your testosterone. So I get this question all the time, which is, oh, I saw my regular doctor and he told me that my testosterone level is okay. The question is, there is a difference between okay and being optimized. Keep in mind that when your testosterone level goes low, then you will start to lose a lot of your muscle mass and a lot of your bone mass because your testosterone hormone is what's keeping this strong. So if we are trying to keep you healthy, if you're trying to keep your muscles and if you're trying to keep your bones, That means you might want to keep your testosterone level at the optimal level. You don't want to just be okay with an okay level. Is going on testosterone therapy will help to improve my sexual performance? The answer to that is testosterone will definitely help a lot with your sex drive, but not necessarily it will help with your performance. There is a big difference between the testosterone level and your sexual performance. Sexual performance usually rely on the amount of blood supply that's going to your private area when you have the intercourse, and the amount of blood supply can definitely reflect on the actual performance. So don't be under the impression that going on testosterone therapy will help on my performance, because most of the times it will not. If you are looking for something that's strictly for performance, then we can talk about other procedures like P-shot, for example, and what are the other options that we can offer here to help you with that. But it will definitely help with the sex drive, but not necessarily with the performance. Do we do any steroid therapy? The answer is absolutely not. We do not offer any steroid treatment to help you to gain weight or to gain muscles. I believe that if you are to go on steroid treatment, you need to be seen by an endocrinologist. There is a lot of testing to be done before that, and there is a lot of complications that can happen if you are not being treated by the right provider. Can testosterone therapy affect my fertility? And the answer is absolutely. So, if you are middle aged and you're looking to have a family in the future, I will highly recommend that you do not go on any testosterone therapy, because going on testosterone therapy can definitely reflect negatively on your ability to have kids. Why is that? Because when your body is being given any testosterone from the outside, that can suppress the amount of testosterone your body is producing from the inside, and that can affect your ability to have children. So if you are in the middle age looking to finish your family, this is not the right timing for you to go on testosterone therapy. If you ever go on hormone replacement therapy and you decide that you don't want to continue on the hormone replacement therapy, my advice will be we need to do this slowly. The last thing you want to do is you go on treatment and then your body is used to a certain level of testosterone, and then you decide that you abruptly stop everything. That's not a good idea. If you will need help with wearing off your testosterone therapy once you go on it, then we definitely need to talk. We need to come up with a plan, and I will be able to help you through this plan. When we start testosterone therapy, regardless of what type of testosterone you will go with, it usually takes minimum of 1 week for the testosterone to start circulating in your system and for you to start noticing the difference. We always give you a time frame of 1 week to 10 days for you to start seeing the difference since you start your treatment. Of course, there is a lot of details that is going to be customized based on your special needs. This is why if you still have any questions, I will be more than happy to help you through your journey. Feel free to give us a call at 705-712-3737, and I will be more than happy to help you.